strengthen partnerships as Lewisham moves through and beyond the pandemic. It feels like a particularly appropriate moment to be having these conversations because it was 1 full year ago, excuse me, back in February 2020, that leaders in the voluntary and community sector started to have conversations about what could be done to support communities in the event of a lockdown. And similar conversations were happening within the council. The ideas were joined up in March when voluntary and community sector leaders and council main grants programme leads came together and started to plan how the official Lewisham response might be a collaborative one. Back then, the main concerns were around supporting people with particular health vulnerabilities and people who were older, isolated, or economically vulnerable. The plan centred on access to essential supplies such as food and medicine, as well as social connection for people who were isolated. And as we now know, those were the key issues, as more than 3 million people across the country went hungry in just the first 3 weeks of lockdown. The pandemic and lockdown also increased existing economic and social inequalities, and as poverty grew, more people were pushed onto universal credit. And we know that though everyone was at risk of catching the virus and being harmed by the consequences of the lockdowns, some groups were particularly vulnerable because of pre-existing health conditions or socioeconomic inequalities. And during that first lockdown, a great deal of hope and help came from within communities themselves, some of which has been recognised since then by the Mayor's Award and is testimony to the empathy and the solidarity among Lewisham citizens. But this report is not so much about the independent community activities. It's focused on the official Lewisham COVID-19 Response Hub during those 2020 operations. If we look at the second slide, I can't see if the slide is sharing, Sam. Great. The second slide shows us a little bit about the hub structure. The hub was a dynamic and evolving partnership that began with 4 organisations that did something quite extraordinary. They anticipated the emergency that was coming up. They gave up much of their normal operations and redeployed their staff specifically to address the crisis. So Lewisham Council funded the work and had a large staff resource and connections that it mobilised. Lewisham Local Russia Green Time Bank was strong in volunteer recruitment and project management. Age UK, of course, is a specialist in supporting older people. Voluntary Services Lewisham had expertise in befriending, volunteering, and of course that crucial area of transport. And Lewisham Food Bank, the 5th partner, was brought in a bit later to grow the operations. But that core partnership of 5 organisations offered leadership, coordination and flexibility in their response. They connected up with key associates and a wider network of organisations that included the food banks and other community projects. If we look at slide 3, we can see how many people were reached. The hub partnership turned out to be a major and distinctive achievement because it successfully helped thousands of people in need of food, befriending or practical assistance. But it also generated a very large number of volunteer opportunities and engaged newer communities. But by the end of the first national lockdown, it had grown quite a complex process at scale and left a legacy of new networks. We can go to slide 4. We'll see, I want to kind of address a bigger question that keeps emerging, which is what can be learned from the experience of the hub? You know, what can we tell others who might want to set up something similar? Well, here there are quite a few points, and the first being to have a clear and achievable purpose. In this case, there was a strong focus on providing food, befriending and practical help to those in need. The operation involved reorienting existing work that organisations were doing and redeploying individuals to create a joined up response, or what somebody described to me as something bigger than our own organisations. Also to build on pre-existing relationships in order to hit the ground running. So the hub partners in this case had worked together before, So there was a basis of understanding and trust for them to work from. The main grants programme had been important in growing a VCS infrastructure, and it was some of the voluntary community sector leaders that worked with the council to create and maintain the hub. The next point is to be open to expansion and scaling up with external expertise, with space or skill sets if they're needed. So for the hub, the need for help with food grew to the point where there were some logistical challenges in sourcing, distributing and delivering what amounted to 1.5 tonnes of surplus food each week to community organisations. The hub overcame the challenges by securing the help it needed from organisations like GCDA, FareShare and Phoenix Community Housing to scale up delivery and access surplus food. The work couldn't have been done without investment in the hub or without the existing main grants programme organisations and the redeployed staff and volunteers. So another area of learning is to make adequate resources available and pull together existing assets, because that turned out to be vital. The hub voluntary community sector partners redeployed all of their staff, and the council also redeployed a large number of staff to either the shielding support work or to the VCS organisations themselves. And this was especially seen as positive where there was a strong skills match and council staff could connect very closely to community organisations. The VCS organisations proved to be particularly agile, which obviously is essential in an emergency. They set up a website and a telephone line within a week and rapidly redeployed their staff. The service itself was also able to make deliveries and respond to callers promptly. Clear communication channels were needed, so there were daily online meetings to raise matters that needed to be resolved. While regular meetings are important, that process of coordination for transparency, another area of learning was that the meetings are best kept as focused and short as possible. The telephone line was the single point of contact for people who needed the hub's help. The people taking the calls were able to coordinate across multiple organisations and were involved in delivery and triage issues. Taking calls through one channel produced speedy responses and duplication was minimised. But another benefit of the coordinated partnership was that when an organisation came across a need that perhaps they couldn't help with, they could actually refer it back to the hub for it to be addressed. Slide 5 continues with some of the learning that comes out of the hub experience. One of which is a data analyst could be involved to ensure that data systems and platforms are compatible and resolve system bugs. This became apparent when the data on who was shielding that was coming through from government couldn't be easily transferred onto the hub's platform, and the data analyst was helpful here. There was also a great deal of spontaneous offers in terms of volunteering and donations. Nearly 2,500 people signed up as volunteers across the hub as a whole. And in addition, there were people spontaneously volunteering with other organisations. But not every volunteering request could be accommodated. But it demonstrated that in a crisis, citizens who might not ordinarily volunteer do become a vital source. And so in setting up a hub like this, it's important to be prepared to manage the range, but also the high level of volunteering requests that can come through. Offering some form of wellbeing support for those who are providing a hub response is also important, because the extraordinary level of humanitarianism can obviously take a toll on those who are organising it. By August, people running the hub were physically and emotionally exhausted, having worked the emergency response day in and day out. They were also concerned about whether the council could continue to fund their organisations when they returned to their normal roles. An open access route alongside support for people who are referred is also, I think, important. The National Audit Office confirmed last week that councils were waiting weeks for data on who was shielding, and that even when that data came through, there were inaccuracies. So that meant that because of government inaccuracies, some people who should have been receiving food parcels directly from government weren't. But because there was this open access telephone line set up with the hub, this created an accessible way for people who needed it to access support. Taking account of local diversity and specific needs at the onset is also important. It can mean involving community organisations that are already working closely with people with protected characteristics. So organisations with strong community roots that are familiar with specific needs of people from those communities can help design the service and reach those communities. Examples here might be young people needing educational equipment, disabled people needing specific support, or communities from Black, Asian, minority ethnic backgrounds needing culturally relevant meals. While food and medicine was an appropriate priority in the initial response, the extended nature of the lockdown did highlight the wider issues that people were grappling with. So over time, responses for non-food-based support needs is important. So for example, to address issues to do with digital connectivity, fuel poverty, housing, and mental health support. And the last learning point in this list is really about reflecting on an emergency plan, because the hub had to be created very fast to serve a very particular purpose at that time. It could, however, become the basis of a local emergency plan in case of future sudden crises, one that of course would need to be rehearsed quite regularly. So what next when it comes to supporting people through the partnerships? That brings us to the slide on wider issues. Thanks, Sam. We know that the largest part of the service centred around food, and that food banks were invaluable to very many people, and they continue to be. But of course, they're not a solution to food poverty. And indeed, people told me food poverty is rarely a thing in itself, so there's room to grow partnerships around other key issues. Fuel poverty was an area that was talked about, which is growing extensively. Unemployment, of course, which grew when the first round of the furlough scheme ended and continues to as businesses close down. Digital exclusion with a greater need for connectivity and access to appropriate and accessible technologies. Homelessness, of course, is an issue, with support for people in fragile housing situations, rent arrears and other debts being needed. There's issues to do with mental health and physical health that are deepening. Stop and search has been highlighted, with a rising and disproportionate use of stop and search on particular groups. It increased by 40% during the first national lockdown. And then broader social and economic inequalities that were exacerbated during the pandemic. We know that Lewisham was already scoring particularly high in the index of multiple deprivation. So in developing the work, future partnerships, it's worth bearing in mind the local demography. Which brings us to the next slide. In the overall index of multiple deprivation that I imagine many of you are familiar with, Lewisham ranked 48th most deprived nationally. It also has a slightly younger age profile than the rest of the UK, with children and young people making up almost 25% of residents. Lewisham also has a slightly lower percentage of the population over 65 than the national average, and is the 15th most ethnically diverse borough in the country, with approximately 40% of Lewisham residents being from Black and minority ethnic backgrounds. This rises to 77% of the population of schools. It's in this context that the report recommends that partnerships that are developed as we go forward look to involve the voices of young people, BAME communities, those on low incomes, and bring them into the shaping as well as the delivery of services. So for the next slide, what next for local partnerships? The report recommends that future partnerships are built taking account of the full spectrum of issues that we know about and frame them thinking around three main goals. The first being to relieve immediate problems. This was certainly the instinct that led to the Covid Response Hub, and that purpose undoubtedly continues to be vital. The suggested approach is to combine existing social prescribing with some open access provision and mutual exchange, especially given the difficulties that some communities can face getting referrals and low levels of trust in authorities, for example, where people might be concerned about their immigration status. As we take stock, another goal has to be to create new jobs and invest in solutions to housing problems and public health. A partnership approach that builds on what exists can be key in that, with partnerships facilitating solutions. I'll talk more about that in a moment, but I just also wanted to log the third goal, which is to work with an ethos of democratic community engagement. This can help perhaps combine the immediate and the broader issues. For example, democratic renewal and community engagement work could be at the heart of showing that what appear to be individual problems or cases are actually pointing to a need for wider policy and structural change. This approach could be positive in promoting the growth of active citizenship that the pandemic has already triggered, not only through volunteering, but also through the designing and delivery of solutions. Going on to the next slide, how can partnerships help with wider issues of job creation, housing, and so on? It's certainly daunting to think about the road ahead and the solutions needed. I think partnerships do have a role in growing opportunity structures and kickstarting the creation of local and regional jobs, for example, through developing projects, collectives, and cooperatives that address people's needs. It's possible to grow employment and training in a way that links in with this. So, for example, developing community-based cafes, kitchens, gardens, stores. These could create jobs, conversations, and meet other needs at the same time. The pandemic exposed the criticality of medical staff, of teachers, social workers, creatives, mental health professionals, and others who serve people's needs. Partnerships could explore the expansion of training in those lines of work, perhaps mapping and coordinating a wider range of training and volunteering opportunities that could be pathways to qualifications and paid work. The first national lockdown showed how people who were homeless could be sheltered and supported in otherwise empty hotels. So there may also be some scoping of empty buildings to be done and planning how they might be repurposed. As the vaccines take effect, there's hope to create communal neighbourhood centres and kitchens. Along with access to good hot meals, centres could provide information, support, activities, and internet access. To incorporate diversity, groups from different communities could run these, even if it's on a pop-up basis supported by community workers. The advantage of this sort of approach being that they'd be varied, help people learn about the makeup of the neighbourhood, and act as spaces of community conversations that then generate more ideas, decrease isolation, and grow mutual support systems. And then there's campaigning, perhaps campaigning for a universal income or another way of providing people with enough money to live on. The pandemic and the furlough scheme show that this is not idealism, but that is needed as a central plank in recovery, not least to allow citizens to access the basic necessities of life with some dignity and enable everyone to play an active role in revitalising their areas. But how can this be implemented? We know that local authorities are financially squeezed, so there is a need to press for more national resources as well as policy change. Partnerships can develop local campaigns and movements that address the issues that people are most concerned about and involve citizens in that process. It can mean facilitating service user and civil society conversations and alternative solutions across the range of communities in Lewisham. I think it means building on the cooperative and the democratic ethos that grew out of the response to lockdown and grow new spaces of community education, co-production and conversation. There's been a lot of talk about thinking local, and yes, we do need to think local, but also cooperate across providers and borough boundaries and link up to build national movements for change as well. Of course, this means involving everyone who has a stake in Lewisham, so there is a collective sense of thinking together in a post-lockdown plan. Which brings us to the final slide, Sam. The report points to the advantages of partnership work, which is at the heart of the Lewisham way of doing things. And as this slide attempts to show, The report identifies the need for partnerships going forward to be framed with 3 areas in mind that could ideally overlap: relieving immediate problems, creating opportunity structures, and democratic renewal and community engagement. I hope you'll find the report useful for your discussions in thinking about these areas, and I hope to identify ways to take the recommendations forward. I should also add before I finish that there have been a couple of small but important amendments to the report, if some of you have seen it. So if you could use the version that's currently on the Lewisham local website, that would be great. That is the most recent version. And Philippe, I'd like to end with my thanks to all of the Hub partners and the people who came forward to be interviewed and shared their reflections so generously. It was a privilege to present participant voices and achievements of the Hub in the report. Thank you.
Great. Well, thank you, Kalbir. Excellent. And as I listened to this and I watched your presentation, I'm thinking, well, didn't we know all this before? Why didn't we do it before? And it's interesting that it needed a catalyst in a way for us to get together and mount this massive response that we did. And obviously, and if you think a little bit about in terms of logistics, one might think that the army would be the kind of people that would they rehearse every day. We had no rehearsal. You know, mid-March there was no rehearsal, and very quickly we mobilized. And are we learning a lot from this? So thank you a lot, Kalbir. It is really refreshing to just to listen to your report, and lots of learning to take from that. Okay, so I think what we need to do now is perhaps and remind you people that you will need to select in your chat room which of the breakout rooms you'd like to join. But we're going to take some of the questions that came to us when people registered for this event. And the first one was, will charity organizations still receive support and grants after March 21 to continue our work in the local community? Saki, maybe you would like to take that one?
I think in short, yes. I think it would be unconscionable not to have support to the voluntary and community sector that's delivering these very important services. But with the caveat, of course, that as you all know, there are massive cuts to be made. There are massive savings that the local authority has to make. But we do still have a main grants program, even though it's having a cut of about 800,000. But yes, there will still be funds for the voluntary and community sector, absolutely.
Great, thank you. And I think the next question may be to you again, Saki. Sorry about that. How has the info the hubs collected about those in health needs in Lewisham been organised and used for long-term well-being provision?
So one of the things I would say is that from the local authority's perspective, having a front door through the Community Response Hub that did 2 things. One, it really supported those people who were shielded, the 10,000 people who were shielded, who were approached directly by the local authority and said they needed support, were referred to the hub. So that was one arm of our response. But the second arm was being just an open access front door that anybody could call up who really needed help, advice or support. And I think actually what was really helpful about that is to have one place where we could identify what the health and well-being needs of residents were through that very difficult period. So absolutely the information that we collected throughout that period informed the services that we provided and how we dealt with emerging needs. So the shopping service, bespoke shopping service, is something we developed after a while because we knew that was a specific need. But going forward, it absolutely is informing our prioritizing around main grants and where we look to spend our funding, as well as in terms of health funding going forward, and all any funding that's available. Some of the needs that we've identified, well, in fact, all of the needs we've identified, and the thinking we're doing around what people will need as a result of their experiences will absolutely inform how funding is spent going forward.
Great, thank you. The next question was, what are the key transferable learning opportunities from this report? And I think I'll take that one. I think it's one of the slides, Kalbir, that you provided when you first started saying that we had a clear purpose to start with. But I think that some of the learning that we can take from this is that actually we might not have been able to do this if we hadn't had the existing relationships in the first place. So some of the learning from that is that we need to keep relating with each other as organizations and groups so that we are quickly able to mobilize and to also pool our assets together. Why we were able to do this is because we did pool our assets in terms of people and so forth. And of course, the redeployment of people across organization was literally incredible, never happened before. And so, and that requires being open and being agile and being open to share what we have and not to work in silos. The agility and also the communication, having really clear communication channels, because actually you can't entertain something that big without having really good communication channels. For those of us from the partnership, from the hub, we had Zoom meetings every day, very long Zoom meetings, 2 hours, sometimes 3 hours. But it was difficult, but it enabled us to share information and to come to decisions together. That was really, really important. And I think that's probably, I think, the solution for Lewisham and our future. And one of your slides, Kalbir, I can't remember which one it is now, but it's actually we can do so much, and we can go forward with having that agility and this ability to communicate and work together. So these are some, for me, those are the learning points, and those that work also led to a lot of networking. And if I give you an example, during the COVID response, we set up this food network, and this is happening now. There's over 40 groups involved in this. They're meeting every week, they're sharing information, they're planning together. And the principle of that is everyone's invited, everyone's valued with their assets and ideas. And who knows, you can create other networks for employment, for example, create solutions together, co-produce solutions together is the way forward. So that was my question. And the last one is, following the experience of partnership working between the Council of ECS in responding to the pandemic, how do we think those principles should apply going forward during the recovery phase? Yeah, during the side. I'm not quite sure whether Ross, you were going to take that, or Saki, I can't remember. Who wants to answer that question?
I wasn't going to take that one. I'm happy to have a go. I've got a written version of it. So, sorry, can you remind me what that one was, Philippe?
Following the experience of partnership working between the Council and the VCS in responding to the pandemic, how do those principles should apply going forward during the recovery phase? We were going to be discussing that in the breakout groups, but
yeah, I think that overlaps a lot with the response you just gave to the previous one. Really, I think it's about trusting the voluntary sector, having a clear sense of what it is we're being asked to achieve. Because one of the reasons this worked so well is because we all knew exactly what we were trying to do with the hub and all the response. We've been saying for years in the voluntary sector that we're close to communities, that we're agile. And we proved it. So I think it's really those same things. It's about building on that trust that Lewisham was able to do better than many areas, because we had a strong baseline of trust with the local authority, but particularly as well across the organisations with each other. So I think that was really helpful. So I think it's about just, yeah, building on what we've done, really, and being clear on what the purpose is. And if we can try and develop the next stages of this with really clear outcomes in mind, I think that will be much easier now than it would have been, and certainly that it would still be in some other boroughs which are going to have to try and catch up to where we are already.
Yeah, there was a question about that. Sorry, I'm looking at the questions about how your research compares Lewisham to other London boroughs, and that's exactly who's raised her hand has mentioned she's in touch with other boroughs, and so she has kind of an overview of what's happening.
Yeah, so I think it's what Ros has said, really, basically, that when I looked at other boroughs and what they were doing, they were working with their voluntary sector, but basically either funding.
Nope, we're not hearing you.
Can you hear me now?
That's it, yeah.
They were funding them extra money, or potentially commissioning new services in order to create hubs, response hubs. And we didn't have to do that here because we already had such a good relationship with our funded organizations that we were able to come to them very quickly and say, guys, let's do something together. And I think actually that is really, really different. And in fact, when we put forward our community response hub as a good practice example, that was the thrust. That was right at the center of what we said. Our existing relationships enabled us to ask people to do things for nothing. You know, they redeployed their staff, they flexibly changed their plans and completely put their hearts and souls behind this shared goal of supporting residents. So that's what's different and important.
Mm-hmm. Thank you. There was another question which kind of been answered a little bit, but what has been learned about the strength of the voluntary sector in the borough. I mean, some of us, we've been around for a long time. We know that the voluntary sector Lewisham has been quite amazing and had done extensive work over the years. I guess the strength of it has been, it has had the ability to adapt very quickly to this effort. You know, just get their hands on the plow and did it. And that's our strength. And possibly our strength is the fact we are, you know, we know each other. We know who's doing what and so forth. And that does help because then you can start to say, well, you know, maybe you can share across the board what we have. So it is a very strong sector. That's one of the hallmarks of Lewisham, a very strong voluntary sector. And we are really thankful for that. And our task now is to keep strengthening it and to develop it. And I think we need to also acknowledge that the voluntary sector is not just the granted organizations as such. There are loads of people in Lewisham doing things. The mutual aids appeared during this effort. So there is a rising of community action on the ground in Lewisham. And that is really, really interesting. And so it is strong, it is vibrant, and we need to move forward with it.